Hello, dear friends. I'm really glad to see you all here today. It's a big pleasure. Thank you very much for invitation. I am aesthetic dermatologist and I have been working for more than 20 years in this field. As you heard, originally I come from Ukraine, but now I have to live in Switzerland. And the thing is that I have to study German. And don't be surprised, because sometimes you will hear German words. I'm not able to control it. Okay, and now let's get down to our interesting lecture. This lecture will be as introduction. Maybe you are already experienced in this field. Then I'm open to more interesting questions or about details that you are interested in. REJURAN. REJURAN, it is the product that we injected in skin. It's exactly polynucleotide. You already know that the market presents a lot of such production. And I will try to explain you why it's so, why our molecule is better than other one. To make you interested at the beginning, I decided to start the lecture with practice a little bit, where we can use REJURAN exactly. Certainly, it is with photo damage, with pigmentation, with different kind of dermatitis, with scars, with scars after surgery, after acne, with the fresh stretch marks. Very big problem, alopecia, and stressful situation. A lot of times we don't understand the reason why it happens, and in this case, REJURAN can be a very big support in your protocols. And the big problem for all of us is chrono-aging. You can also put REJURAN in your protocols. All ablative procedure can be supplied with REJURAN. Some words about our company. It's placed in South Korea. It's a big international company that has long history, more than 30 years. And REJURAN was presented in 2014 after 21 years of research. Also, what is interesting, that company have exclusive agreement with the special company who produce salmon, purified salmon, the best source material, only for pharma research. Other companies use artificial products which grown up in artificial condition, not in the Pacific Ocean. REJURAN have GMB accreditation, a lot of certification. You can use that product in Europe. Also, domestic market present you certificate for different ingredients and also for the product. You can make photos and then later find out more information about this certification. So, what is the difference from the beginning? It is the way we produce these products. It's called DOT technology. DOT technology patented only with REJURAN. Any other company can't use it. What does it mean? From the beginning, that at the end of this process, we're getting the high quality polynucleotide, which have 3D scaffold shape, high weight, and high purified. And that helps you to stay in safety field with your patients and to avoid allergic immune reaction and so on. Very important part about source material. We are producing REJURAN from the special type of salmon. It's called Ankarinka sketa, and it's grown up in natural condition in Pacific Ocean. The producing company started the process in fresh water from caviar to fly, then get possibility to the fish to spend their life in the natural condition, to eat plankton, not the meal with antibiotic and such things. And that again didn't have damage to the DNA, to the DNA. What part of the fish were taken for the product? It is reproductive material. Why? Because the connect compared to the other part of this fish is the higher. The second part is cleaner from impurities. It's also very important. And it's not only one advantage, because I think as you use in my diet fish, and thanks to REJURAN, I understand that there is a big difference between wild salmon and farm growth. And even when we eat wild salmon, it depends of toxic substance where it was grown up. For example, European salmon also have the big amount of toxic ingredients such as polybromide ethyl. And if the fish grows in the cold water of Pacific, it also didn't have any zoonotic virus. It's very important, and for your patients, when you inject, you can avoid again some immune reaction. This toxic substance can cause a lot of problems, and you must care about your diet now after our lecture and to look through where this salmon was grown up, because it can cause cancer, different problems and disease with thyroid gland and neurology problem also. The meal that we eat not only very important for the fish, for human also. And here I present you independent research. It was made in the United States. The university take for this research 7 farms all over the world, and in laboratory proved how much these ingredients in different kind of the fish. And you see this diagram, and again it's proved that the fish that grow in the Pacific Ocean in natural conditions is the better one for the producing polynucleotides. So, to sum up, the first important thing is the DOT technology. The second part, we have a lot of articles, a lot of publications. Some of them, for example, it's experience from 1,500 doctors from South Korea and so on. You can find it in internet. And DOT technology gave us opportunity to produce high purified, high concentrated and high molecular weight polynucleotide. You all know good what does it mean DNA. It is the main molecule that keep information about us, and I will remind you very fast about the structure. So we have DNA, RNA, and very important part is that we have order of nitrogenous base, such as adenine, thymine, guanine, and cytosine, and the same, almost the same in RNA, only uracil instead of thiamine. And the order of the polynucleotides with this nitrogenous base made our genetic code. And one nucleotide, it's precursor for polynucleotide. It can be explained so. The first, we are having nucleotide, then a lot of them stay together, and you have polynucleotide. Then a lot of them, it's DNK. It's difficult even to explain this structure. Yes, it's a high level, and only God can do this. We understand? It's not explosion or something like this. And now I explain you about nitrogenous base. And between this Ancarinus cascata salmon and our body, we have genetic similarities, also, almost 97%. And again, this DOT technology gave us opportunity to purify this product from the difference. And don't be scared that you will inject your patients. If you have some process in your tissues, for example, it's some damaged, and your cells stay injured, your body will destroy it to the small bricks, and then this part of nucleotides it will use again. The same happened with polynucleotide REJURAN. If you injected our phosphodiesterase, destroy it to the part and use these small bricks to build the new DNA in new cells. So I hope that it's understandable that at the end of this process we are gaining REJURAN with high concentrated 20 milligrams in 1 milliliter with high molecular weight 1,500 kilodalton, high purified and free from impurities. This process is very long. I'm not a technologist, but schematically I show it. And at the end, thanks to this DOT technology, we are getting polynucleotide and polydesoxyribonucleotide. Here is the article about the very high resolution scanning microscopy. And thanks to this, we understand the structure of REJURAN. Again, this magic word, better to say sentences, free the scaffold. It's exactly this, yes? And it helps us to have long prolongated result and also to repair extracellular matrix. It's a very difficult structure, and even this research showed that we are in the beginning. It also helps us in the future to achieve better results in delivering different medicine. And here you see the photo of polynucleotides, polydesoxyribonucleotides. The difference is that polynucleotides we can use not so often because of this molecule. Polydesoxyribonucleotides we must use more often. And now we will speak some words about mechanism of action. When we eject REJURAN, the mechanism works in two different ways. The first of them is activation A2 adenosine receptors. These receptors answer for anti-inflammatory effect. It's very important to understand from this picture that these receptors we have on all mesenchymal cells. And this product depends from the dose. If you will use the smaller amount, then you didn't activate these receptors because it causes the cascade of anti-inflammatory reaction, such as first It's stop producing inflammatory interleukin-6, interleukin-12, tumor necrosis factors, and the opposite situation is stimulate anti-inflammatory interleukin-10. And this interleukin help us to reduce time of producing new cells. It's also activated different growth factors such as fibroblast, chondroblast, epithermal growth factors, and insulin growth factors. And they activated cells to produce new extracellular matrix, collagen, elastin, hyaluronic acid, proteoglycans. And about capillarities, it also vessels, epithelial growth factors, it also activated producing new capillarities. And it's noticeable when you do the surgery, maybe the surgery is here also, and you're interested. For example, the most often our patient do blepharoplastic. It's not it's noticeable, this scar. Certainly it depends on the tissue of the patients. But if we use these products after surgery, even after 2 months, after 3 months, it's really helpful. And noticeable when your patients have vessels, you look to a patient and see that after surgery he looks tired because of this redness. This redness goes from the first procedure. And even after 6 months, it also has sense to inject. So, we were speaking about the first way of mechanism REJURAN. It's activating A2 adenosine receptors. The second way it's to produce new polynucleotides thanks to injectable polynucleotides. It can be compared when you build some new house and you want to use the older one, but you want to make this process faster, and you ask help, and someone brings you the track with the new bricks. That's happened with polynucleotides. The normal way that happens usually in our body without REJURAN, it's called de novo pathway. It's synthesize new DNA from precursors such as lipid acid, amino acid, and we can compare these two processes. It's with REJURAN, we don't need such a long time, first of all, and we save energy. Yes, it has sense. So at the end, we can sum up this information. Yes, you have two variations of action. A2 receptors, yes, and the second way, when we're using REJURAN, it stimulates your cells, they produce new collagen and so on, yes, and it also helps to create new capillarities in the healing process and make it much faster. Now we will speak about the product that presented it in your market. The first called REJURAN Healer, the second one REJURAN I and REJURAN S. We call it sometimes SCAR. They have different quality. For example, REJURAN I, it's the product for the area around your eye where it can cause edema and you want to avoid. It's easier to diffuse this product, and I will show you later research about this. The stronger one is REJURAN S, and healer is universal and medium. But there is no prescription that you must obviously inject these products in for the scar or for the whole face. You can be like art, create your own plans, as we do. Nothing happened if you will use REJURAN S, for example, for neck, décolleté, combining with peeling or with radiofrequency. or opposite. It's also depend on your wish. No, I don't inject REJURAN S near eye, for example, but I can inject with REJURAN eye scar also when it's too strong and it's difficult to make injections and I don't want, for example, volume effect. And small benefit for all doctors, it's the needles. The needles, it's from Japan Beer products. It's comfortable to work you, and it's easier to pass through procedure to your patient because it didn't cause bruising, edema, and it's much easier to inject. How to inject it? It depends on the zone where you inject. For example, near eye, certainly you must use the angle 15 degrees and make this injection superficially, maybe sometimes deeply. The standard course is 1 in 3-4 weeks. You can repeat procedure once in 3 months. But again, it depends on the situation and on your own experience. Sometimes, for example, my patients have dermatitis, and even one procedure gave them result. It's extremely shows when the women have perioral dermatitis. You know that it is a very big problem because they have as a prescription hormones and they continue to use it long time. It causes atrophy and then nothing works. Even one procedure, I usually use REJURAN S without anesthesia. I just inject this area very fast, 1-2 minutes, with big pupils, but really deeply. And after one procedure, they are satisfied. I repeat 2 sections, and then they come to me after 3-4 months and want to repeat the same procedure. I think you should try because this problem is very big, and if the woman have, for example, some urology problem and it shows on her face, we're not able as a dermatologist to work with cystitis, for example, but this problem is here. It's like science of this problem, and you helps immune system of the skin and see the result. I just want to give you some position where you can get through and to have more confident in this product as a practitioner. REJURAN Healer. You can use it for dry skin, like a revitalization. You can use it for aging protocols, for alopecia, for working with small wrinkles around eyes, no problem, with the skin of your neck, décolleté, everywhere. And also in protocols with rosacea. If my patient didn't answer for botulinum toxin, you can use it some sessions before. Then you can make pause and repeat botulinum toxin. It's also possible. Here is my mother-in-law. She is a happy woman. Her daughter is aesthetic cosmetologist. She is 72 years. I inject you with the plan. Here I was using papular technique. Why I prefer it? Because it's very important to spread this product equally. As I told you before, you must stimulate as much receptors as it's possible. Sometimes we can use dot, but under the ligaments it has sense. In this case, no problem. You can use cannula if you want. The system of injections is the same. It's my case. This woman is 72 years old. She came to my office for anti-aging program. She was not interested in her inflammation, and we decided to combine IPL, I'm sure that you have this system also, and REJURAN Healer. You see her picture after 7 days. It really works. you can combine, and again, it's work with your immune system, like anti-inflammatory effect.
Same session?
One session. No. With IPL, it's better to do pause, and it depends. You work with patient, you know how reactive they are. This patient is 72 years. It's painful, first of all. She is shocked with IPL. For me, I can do both in the same session. Our Korean doctors do everything together. It's amazing, you see. And their system, they, for example, inject it, and then after they do radio frequencies, mass therapy, and so on. Maybe it has also logic, I don't know, but I share with you with my experience. Here, the combination of procedures, IPL, peelings, and also REJURAN. It helps you to achieve faster results. And in these photos, we observing all the list of the problems that can be solved out with REJURAN. Here the two publications. The first one about erythema, where REJURAN is opened. You can also make some research and join to the team. And it's said that the group of the doctors that shows their result says that result is perfect, but it needs more research. The second is the publication of 1,500 doctors. They shows the list of patients. They were summarized, and as a result, they all were satisfied with the results of REJURAN. The next one, REJURAN Eye. It's easy. You understand, yes, that you can inject it for the eyes, for the face, no matter. And inject it the way you want. It depends on the area. Near eyes, you inject it superficially, 15 degrees. In other areas, it depends again. Korean doctors said that this angle, 45 degrees, is very important, that it spread better products. Our doctors sometimes inject it deep. It can be also discussed. Very important about eyes, it's not to inject patients who have very big hernias. First of all, it's better to send them to the surgery, and after you will improve all results after surgery. Here again, my mother-in-law. She has genetically problems with dark circles around her eyes. Certainly, it's impossible to improve it for 100% and in 72 years. But to give better results in this area, it's possible. We inject her, and also you can inject this product after surgery. Why I show you this patient here? This woman has...
How much time after surgery you will start to inject?
This Korean doctor said 7 days. Our doctors not let the patient started it so early, because you see, I have only dermatological clinic. I am not working in pair with surgery. And usually the patient come after 1 month, 2 months. As I told you before, it's in any way has sense. It helps to reduce swelling, to reduce these small vessels. I have a lot of patients with red skin, very sensitive skin. It's really often in our country. And the surgeon knows that when you do the procedure for such patients, after they have a blue eyelid, no, not blue, because the vessel structure is noticeable. After the first procedure, I observe real work of vessels growth factor. You see, it's it's true. And this patient, she has diabetes, the first. She certainly inject insulin, and you know how difficult to work with such patients because they are very sensitive and sometimes they have complications with bruising and so on. We inject her during 5 years because we're already working with REJURAN from 2018, and we even have more products from REJURAN, cosmetic, the products for surface, and also the products that mixed with hyaluronic acid booster. And to avoid complication, I make a decision to make for her only REJURAN. I inject her with polylactic acid, then I gave her possibility for regeneration after 4 months, but I inject her with with Sculptor once in a year, because you understand it's very difficult. REJURAN S, you can use it for different kind of scars, for stretch marks. If you experience in treating stretch marks, you know that these problems is in reality very difficult to make something, to achieve good results. But if this stretch marks fresh, you can start with REJURAN. And if you combine it with ablative laser, it won't give you pigmentation, because I observed before I have REJURAN a lot of time such a problem. With REJURAN, there is no pigmentation.
Same session do you do?
Yes, you can do in the same session.
And you start with the REJURAN and then...
You can always prepare your patients with REJURAN, because it depends on many factors. You understand that sometimes they don't have time or something happened in life. It's not obviously. With REJURAN, it's in reality very easy to work with for the professional. You just create your own plan. And about ligament treatment, you can inject it almost the same as Profiler by punct. It's no problem. And today it's very popular to dissolute lips. And also you have around the lips wrinkles. The nature is the same as a scar. You can make blanching around mouth and near eyes, the same system. And also you can inject it in different parts of the body. This woman, she's opera singer, and she cares about her face. She has a lot of makeup and she has acne. We treat her with topical treatment because the problem causes cosmetic using too much, it can be said so. And then after she was not satisfied with the effect, certainly she can wait 6 months or 1 year, certainly it goes away, but we've done it in 1 month. We inject her, in 2 months, I'm sorry. We inject her 4 times and such a good result. I recommend her to make erbium laser, and it will improve her skin. This funny situation I've done for this girl TCA peeling, and after she decided to go to make massage, she laid down in this circle and injured her skin. Thanks God, she came and said, Anastasia, I have such a problem, please do something. And we decided to inject her with REJURAN. You see the result after 4 days, because there is a sign of bruises, it's yellow. It shows that it's not 1 week or something like this. At the end, she didn't have any erythema or pigmentation. Unfortunately, she is very young, you understand, and difficult to catch these people for the last photo. Here, I prefer in my practice to make peelings for age pigmentation, certainly when it is safe and not dangerous. And after you have this redness, patient can wait 1 month. And I also show the result of such peelings. I have a lot of pigmentation and I fight with it the whole my life. And this redness was not comfortable for this woman, and she decided to solve it somehow. And we've done one syringe of REJURAN. We divide it in two parts. The first we've done under the spots, and other we used around her eyes. And you observe, even around eyes, it's much better. It's only one syringe after a week. Again, we observe the result from vessels growth factors. It's really work. And there are a lot of publications the same from REJURAN in articles I will share with colleagues, and she can later show you these results. Scar. Unfortunately, it's my administrator. She injured her hand, and after she had very difficult surgery. She has problem with swelling, with loss sensitivity. And you see, I inject it the papilla after papilla. It's not so comfortable for such patients. We make anesthesia, and after I inject her. The course depends on the possibility of your patient, how it's possible. Here, she's my staff, and I care about her. And such results we have after 1 month. 1 month of treatment. We use REJURAN, and also we have LPG. And all together helps her. No, you see this result, and we must continue. It happens only 1 month ago, 2 months ago.
Why LPG?
Why LPG? Because we are having it in our office, and it helps with swelling also. It's drainage procedure, and it has in endermology the special protocols in the system for the scars. It's not some research. It's the company of LPG gave us such opportunity. And we also use LPG in many protocols, and I prefer it with the polylactic acid when we inject. The second day the patient came, and we also do LPG. It's a perfect solution. They don't have to do themselves massage. And I also pass through this procedure. I think you also know it's very painful. And it's reduced swelling, pain, and regenerative process goes much faster. That's the reason. It's from a case of one of doctors. I think that it's the most impressive. I decided to put it in my presentation. It's a big explosion, and the woman was hurted. You see a lot of scars. Here was done 7 sessions of REJURAN S, 10 procedures of PRP, and also it was made botulinum toxin. And the result. You can find it later. I also shared. So, to sum up this part of information, when we get result, what we can set to our patient. First, after 3-5 days, it's hydration. Then, after 2-3 weeks, we see the reduction of small wrinkles, the pores. After 6 weeks, we see lifting effect. And at the end of the course, it's general rejuvenation. It helps to support immune system of the skin. We must understand that skin, it is the biggest organ of our body. A little bit about combination of different procedures. I wouldn't be repeat. With peelings, it's only proved your results. You can use superficial peelings or medial peelings, no problem. You can prepare your skin, inject immediately after, or then make the fast regenerative process. About IPL, you can make pre-course and after. Botulinum therapy, you can also use it with the injection mix. Our colleagues from Korea, they mixed in one session, for example, botulinum toxin, bilateral soft, for example, you can find it in internet. Also, botulinum toxin Bokutur, inject this. Xemin, you know Xemin?
We sell it as well.
The thing is that Xemin has your name here and in our country also, and in Europe it's called Bokutur. And immediately after this injection, he made radio frequency. But it's the style of South Korea. They do everything in one session. But I do first radio frequency and then immediately after injections. Now, first of all, it's not so painful because it's painful already from radio frequency. They feel itching and so on. And if you inject, you observe the reaction immediately after. And it helps to make this renovation process much faster. And about neck, why not? You can combine it with REJURAN S, for example, to take 10-20 units. It depends on skin quality or décolleté. I understand that in reality it's not work, but it's work. I make this sport here during 15 years and my clients are satisfied and I too. With surgery and thread lifting. No, thread lifting, it depends what is the difficulty of the procedure. You can prepare your patients. If it's not such a big swelling, you can inject or do after procedure. With surgery, it depends on surgeon who you are working with. In clinic, you can also make your research with clients. I think it will be also very interesting. And about ultrasound, about HIFU, it's questionable. In Ukraine, we prefer to give possibilities after this procedure to work all studies of inflammation because it's burnings and we need it. And if we will stop this reaction, it didn't give us good result from the HIFU or Altera or other machine. That's the reason you can prepare patients and then inject after 1.5 months. About different mixture. Today we will show you the procedure with stillage Kidra on the neck and décolleté. About radius, you can use if your patients can pay, no problem. Because the action of radius, you understand that it's mechanic action, and you also activate and supply this effect from the other side. And you just take a syringe of radius and REJURAN healer. If it radius with lidocaine, then you not put lidocaine. If you need, you can put it inside your syringe and do the procedure. Before REJURAN, I use NCTF. It's also very popular. Yes, you understand, and I never have any complications.
And how much do you put for one syringe with the healer?
For the healer, one syringe. One and one. Yes. Mm-hmm. About polylactic acid, I don't know your attention, but I'm with the respect because a lot of complications, too many complications. And in our country there are a lot of these products. People are not doctors, they use it in a crazy way. And this complication, when I understand, it's scary. I have very big fears about this. And I think it's better to avoid this mix. And also I show you the publication. It's research from all the products that very popular today, exosomes and so on. And they also discuss that it's better to avoid this mix.
For how much time, if the patient already did sculpture, how much time he need to
It's again depend on the age. For example, I inject myself once in a year. There is some research that even after 12 months with Sculptra or other PLL, collagen produced. And you understand, I always explained in a simple way to my patients why I decided not to inject young people, that the process goes on. It's better not to involve in them, let them to work. We can only support. After 4 months, no problem. I never saw any complications. And I am, before you, I was in March injected by PLL. I inject many times different programs with REJURAN. Then I've made IPL in August, MOXIE in September, and I also do REJURAN. And as I told you, I fight with pigmentation all my life. This small research about diffusion. It's only for understanding. We inject REJURAN I as an healer in the arm, and then with ultrasound control the result. And here we have provement that REJURAN S is less diffused in the tissue, because after 24 hours we still have small papilla. And for REJURAN I, you observe there is no papilla. But you must know, I'm honest with you, for example, I have longer time papilla because I have too thin skin, and I inject myself from 25 years old. You understand that aesthetic cosmetologists, the most difficult patients, we always have incredible reactions. And ordinary patients, it's no problem. And the question about PLL, if the patient, for example, 72 years old, you must do another protocols. You must inject her, for example, 3 times in 4 months and so on to achieve some results. It's different from the age. That's the reason why I told you so. And the last is about our safety again. Because you can have scare if you will inject in vessels. You can have occlusion. Especially, for example, in forehead or when you inject nasolabial as a blanching. What will happen? Here we used poor rabbits, but they have anesthesia. They were injected with HA filler, with REJURAN S and I, and you observe the result. Necrosis after hyaluron acid. After REJURAN, you don't have any problems. Because, for example, how you can inject forehead with big papilla, 1 syringe. If you want, prepare your patients for better reaction after botulinum therapy. As I told you, the mechanism is very important to activate the biggest number of receptions, and it depends from the dose. A little bit I will compare our product with other company. It's spread in our market TVAC. It's generic product. The production is discussable because REJURAN have a lot of departments, not only in South Korea, also in United States. You understand how difficult the legal system there. It have a lot of certification. We have dot technology, and we using wild fish, the natural source of material. And the molecular, it's the high weight, more than from the 1,000 kilodalton to 8,000 kilodalton. PDRN in TVAC have short chain, and in polynucleotides you have this wonderful molecular 3D scaffolds. and it is the unique from the TVAC. You saw how many research I will show you. And my doctors, my colleagues before said that I must make my lecture shorter. And I clean up a lot of them because I didn't want to make your lecture boring. Mastelli, they use farmed salmon, and you already understand that it can change antibiotics and so on, the structure of DNA. They don't have dot technology, the same about molecular, and what differ us from all this brand, that we are giving you the special toolbox. You can create your protocols. You have the product for the eyes. It's easier to solve it. Also, it's marketing, and it's better to explain your patient. You can show that, and also the product for the scars. And as a benefit, it's needles. It's for your comfort and also for your clients. So I'm open to your questions. I hope it was not boring for you and informative. If you would like, please, you can write me in direct or ask now. I am absolutely sure that you will take in your practice this product, and you will find some fields where it can be used, because each practice, each doctor is unique. REJURAN is already sold in more than 30 countries. It's also proven. We have practice from 2018, and a lot of clients came to our office and said, I want exactly REJURAN. And I think then in future you will make also some lectures and maybe some research. I wish you all the best in your practice. I know that next week you will have a big how to say it, Hanukkah. I wish you light, I wish you peace, and thank you very much for your attention.
Thank you. Pain management.
Pain management, what do you mean?
The pain and the injection.
Pain during injections. For me, the most painful healer. Sometimes, I'm sorry, I tell you the truth, I am my own cosmetologist, and the best results I get these 4 years, because I inject myself. And sometimes, when I have good spirit, I'm not arguing with my children, I can inject myself without anesthesia. For example, neck, it's no problems, area near the eyes. My cheekbones also very sensitive, and I try to inject it with creams, that's all. But there are some patients, they said no problem. No, near eyes, it's not comfortable, but everybody go through it without any problem. Even as you see, in 72 years, it's very difficult. But my mother-in-law, as she always said, for the beauty, it's no matter. Pain, it's no matter, yes.
So when we, excuse me, we also got a protocol from REJURAN, the company, regarding mixing it with lidocaine for pain. Have you ever, do you do that?
I never do it with simply REJURAN. With Radius, you don't have way. It's impossible to inject without lidocaine. But REJURAN, I never mix it with lidocaine. I think it's better to avoid such things. We don't understand this process. I learned pharmacy in medical university, but I don't understand it so good, which process goes for that. And I think it's so difficult to understand the thing about polynucleotides, DNA also. We are in the beginning of this research and understanding, but I'm absolutely sure that it can be compared with antibiotics. We don't understand, yes, that it's a new possibilities in future for the medicine. As I told you before, it's not the only what produced REJURAN. They also have another product for medicine. We don't have it in our market, but it is for gynecology, for ophthalmology, and so on. and it can be used for combustiology. I'm absolutely sure that after the war it will be a lot of case report from Ukraine, because we have special organization who gave people charge-free help, and certainly they summarize information. And
we have a work that came from
Ukraine
about wounds of war, scar healing afterwards.
Yes, it's amazing work. It's the doctor from Dnipropetrovsk, and she presented in Korea. I also heard it. She combined REJURAN with PRP, and you saw this report, and in this report also many cases from explosion and so on. Yes, that's true. Mm-hmm.
What about the amount of product you use? Do you recommend what your protocols for amount?
Mm-hmm. No, for example, my mother-in-law, I inject 1 syringe for the face healer, 1 syringe for the neck, and 1 for the eye, REJURAN eye. REJURAN eye here, healer here, healer here.
It's like
5 milliliters, the all amount.
One area it's
Yes.
2 milliliters?
Yes, but you must understand, if it is young person as you, that will be enough 1 milliliter. You can inject your face, for example, with REJURAN.
Inject 4 milliliters.
It's also good. If you can pay, no problem. You can activate and stimulate. No, you observe effect. You see, it's also marketing and how you solve the procedure. If the patient can pay, you won't do something wrong.
Do you recommend, for example, 1 milliliter for 2 milliliter for
It's
eye?
easier to start. If you are not inject and you want to trust the production, you will start from 1 milliliter. You observe the result, but it's nonsense to divide, for example, 1 milliliter for face, for neck, and for the, you can't divide it.
I think she asked if you recommended 1 ml per eye.
I use 0.5, 0.5. Because even when you inject, at the end you understand, oh, I have a lot of product, and then I start to inject it deeply. But it's not a nonsense to divide it. In the beginning, we try to do it, but it's better result when you inject it properly.
Do you inject
Not only superficially, I inject it also deep.
also in cannula deep?
In cannula, I told you before, I don't like cannula. I injected only papillars because you must spread it. And when you inject cannula, you leave just tunnels. Maybe if you inject ligaments for support, it has sense. Why not? And how painful it will be, it's also questionable.
Do you use REJURAN for rejuvenation of hands?
Yes, we are using it also. No, here you can be free. You can inject as you wish. You know, hence it's a difficult area. It's also not such a good response here. And you can combine it also with, for example, I've done Moxie. You understand? I felt myself like a fish with skin. Yes, it was awful. And it stayed with me 2 weeks. But I inject because then I have very dry skin. And I inject it and it goes much faster. I think it has sense. You can do it everywhere. It's very easy. These products, it's easy to sold out, easy to make a lot of procedures. It depends only on money from your patients.
Cocktail Monaco or something like this?
Cocktail Monaco, it's very popular. You know, I think it's a very good trick. And they all came and said, Monaco, Monaco, what does it mean?
What is it?
Monaco, it's when we mixed NCT with Botox. You can do the same, and we will call it Israel cocktail, for example. Tel Aviv cocktail.
We're not going to mix anything at the moment, please.
Yes. But you see, I do for rosacea botulinum toxin. I use Bocuture for the whole face. And the last IMCAS, it also was very good session about sensitive skin. Maybe you also visited. And there are a lot of reports report about combining IPL, botulinum toxin, and also you can put in this, yes, like a mesobotox. I absolutely sure it. I once have a complication. I inject too deep, and my client was not able to smile. Yes, only these things superficially, always superficially. But who are not work doesn't have complication. With REJURAN, no, you can certainly have edema, but I never have strong complication, because you understand, in Ukraine we have the small prices, and the people came, especially now in the war, they passionately want to do something. It's like, you see, they go back to their peace.
Well.
Yes, you understand. We understand that. Yes, and it was so surprised that they come to the office. Administrator is also shocked. He said she want only 20 minutes, but she decided at the end to do all the list. Certainly, we reduce prices, and that gives us possibility to be more practitioner. Yes, to compare us with European doctors, because now I can compare, because they do one syringe, one Botox, and that's all. Certainly, they don't have such practice as we, and there the people want to be natural. They said, "Oh, I wouldn't do Botox in 50 and 60." You say, for us in Ukraine, I started in 25, and I also said them, I do it 21 years, and everything is wonderful. Yes, it's normal.
I have questions. Do you have any experience in scar treatment with CO2 laser and...
With erbium laser. With erbium laser. Mm-hmm. Because you understand, it's not so difficult for regenerative regeneration, and I can do maybe not difficult scars deep after acne. But in any case,
I didn't meant acne, I meant war scars.
war scars. I show you these cases, and also.
I can send anybody who wants. We can send you this case of a war.
And you will see, and you understand here it was also used.
And the other question is, do you inject directly into the scar on the margins?
I can show you video later, you can come. I inject it near or under, it's no matter. You just inject it. It's, you just must transport this substance, polynucleotide, in the area of scars. It's no matter how you inject it.
You treat the atrophic scars.
Also, we can do it, atrophic, you mean with the minus tissue, yes? Then you use only S, because it has the bigger volumized quality. It's the better one.
Is there any use for hypertrophic scars?
You can make it better. You can try. In any case, it's also discussable, and you can join this procedure. These people satisfied even with the smaller result. I have one case. It is the woman, she made abdominoplastic. I didn't show you because I'm not satisfied with the result. But surgery said you must put on Skinneren or this with garlic. That's all. Do nothing. This scars horrible. She have pain in her navi area. It was too high, and we inject. In any case, it's very difficult to achieve result, but it makes it better. The color, the pigmentation, the structure.
Redness of the scar?
Yes, the most important, as I told you, redness. Yes, it's a very good solution. The quality of the skin changed, and some people have difficult regeneration. Some others, the better one, you also understand it. But in my practice, now we have a big queue to the surgery, and certainly the number of complications grows, and we have a lot of such situation, but we inject all patients with REJURAN, and it's make really better. So it's, I think that unfortunately, you're not able always to make photo, you understand, because you forget or we make always fun that we are not do it. Yes, we forget to make photo. It goes through. To summarize these results, it's very difficult. And the best result has practitioner doctors, but they not do so many photos. It's the problems also.
Okay, we're going to take a short break. We have beautiful desserts for everybody.
Yes.
And then we're going to have demonstrations. We have some interesting cases. And I believe they can ask you more questions.
Yes.
During. Thank you very much. I think we all learned so much. And as you can see, we are excited to learn more.
I hope that it was not boring for you because it was too long. Yes, I don't understand how much time was.
It was perfect.
Okay,
Thank you so much.